Hi, I'm Court, and I'm from California, and today I'm going to be talking to you about wound care. Underneath the skin of most human bodies is a mostly sterile environment, except for the exception of somewhere like a chamber of the large intestine that will have a lot of bacteria in it. Modern surgeries become possible because we developed a sterile technique. Physical, for example, ultraviolet rays, and chemical, for example, done today by iodine. Iodine is a first aid antiseptic sold in all local stores. It's used by hospitals, doctors, and nurses. It helps prevent infection and kills germs in minor cuts, scrapes, and burns. In the human body, when an infection breaks out, the skin breaks, and bacteria have the opportunity to overpopulate the site. In a wound, we have to kill mostly all the germs and bacteria to provide it a mostly favorable and a mostly sterile site to grow back. This is a healed wound. As you can see, there's a scab growing back. You want to provide a mostly sterile and a mostly favorable environment like I did for your skin to grow back. So we're gonna debride this wound. You want to get some normal tap, sink, or normal saline to rinse it off. So we got normal tap water here. You just want to kind of rinse it off, get it clean. If you see any debris or dirt, you want to clean it out with using a Q-tip. You can use water as well. So I just wet it, get it all out. Yuck. Clean. I'm going to use a chemical solution like hydrogen peroxide to sterilize it. And you have to rinse it off with water because a chemical will break down the body. Now I'm going to chemically sterilize it using iodine, and you can pour your iodine on little cloths like this. You want to pour the iodine on the cloth, rinse it off, and you have to remember to rinse off the chemical. And you have to dry it too. And you want to make sure it's dry too, because wet. My wound isn't necessarily bad anymore, so I'm not going to do anything. But if yours is still bad, you might want to cover it with something like a Band-Aid or gauze and triple antibiotic ointment. If you're at home and you're letting your wound breathe, or you're using gauze, you want to take it off and let it breathe at home. Your wound may have anaerobic bacteria in it, which means they are killed by oxygen. So that means let it breathe and let the oxygen kill them. Properly and they're still growing red, you need to contact a hospital and may need to take an oral antibiotic. Occasionally, your wound may come very violently, and that may mean it contains a superbug or flesh-eating bacteria, and that means you need to head to a hospital as soon as possible. I'm going to be showing you some pictures and old videos of my wound in the beginning stages, and some pictures and videos of my friend's disfigured arm for comparison. And about a month ago, I developed an infection that was about a 2-inch hole in my leg. And since then, I've been healing it at home self-sufficiently, and it's about shrunk a 1/2 inch. And I'll show you what I've been doing to accomplish it. Regular warm tap water. This right here is hydrogen peroxide. It's a topical USP solution. This right here is First Aid Antiseptic, 10% Providone iodine. This right here is a triple antibiotic ointment, and these are just different types of antibacterial gauze pad. This is a Q-tip, and these are bacteria like Staph and MRSA. A 2-inch hole that was infected. Me and my best friend both acquired the same wound. She, on the other hand, went into the hospital, went septic, and could have died potentially. Whereas with knowledge, you could do this all at home and heal it yourself. And I'm going to do that now. I'm going to show you how to clean the wound properly here. So I put a bucket to collect anything that I drop. So what we're going to do first is we're going to clean it out with a little. No, we're going to clean it out with hydrogen peroxide first. I can't do it with that. I'm going to do it because I just do it, pour a little bit in there. Just that much. And now, get your water. Just want to get a little bit. Because you don't need all that much. And just rinse by the top. If you want, you could do another one just to, you never know what might get it up in there, so just do it again. The bubbling means that it's killing bacteria, so that's actually a bad and a good sign. Wash it off. Now, what we're gonna do here is, I'm going to get this First Aid Antiseptic ointment, and I'm just going to put a very small amount because this goes directly in the wound. Iodine's not bad on the skin. You can get it on there. Just wash it off later. That's what I would do. And then clean this off. Just clean on. There we go. Gonna clean it off. And now, this is the last step. This is if you're gonna go out of the house and have airborne bacteria entering your wound. You might want to just cover it up, because we don't know what kind of airborne bacteria are out there. But in order to heal it, you're gonna need to let oxygen enter the wound, so you don't want to cover it 24/7. That's bad. Now, I'll prepare my gauze. Bitch. Okay. I prepare mine the same way every time. I open it like that. I unfold it like that. And then I do one line of the ointment across the two.
it'll stick like glue later. Remember that. So now you just want to slightly pack the goo in the thing, and then after this is on, you're going to get medical tape. You're going to grab your tape. I do it just about like that. And just about like that. When you're at home, you want to kind of leave it uncovered because there's anaerobic bacteria, and in order to kill those anaerobic bacteria, you're going to have to let oxygen enter your wound somehow.